Let's talk for just a second about government policy. And I don't want to be the cynic here, but
there is government policy on
yeah,
health?
I was going to say, this issue is not going to get resolved. I mean, you may have a bill out of the House of Representatives this week. It's going to be completely rewritten in the Senate. Maybe you get a bill out of Congress this year. It's going to be refought in the election of 2018. There is not going to be stability in healthcare policy. And so my question for the two of you is, if that's the case, how much progress can we make, government policy aside?
I think we can make a lot of progress, and that's why I'll get back to why we're spending so much time on telemedicine. I really believe that if you go through all the use cases of telemedicine, which I can give you examples of, that it will dramatically reduce cost, and it will improve quality. We can now see patients in urgent care, an emergency room setting. We can see them in and out in 25 minutes as compared to a couple of hours. That saves costs in the emergency room. There are artificial intelligence, machine learning tools to help improve operational flow through the organization. That saves a lot of money. There are a number of different applications of telestroke, telepsychiatry, where you can deliver the specialist care right at the bedside. So I really believe that that's going to be something that we should all be cognizant of. And there are many companies now who are coming up with these solutions.
What do you think, Dave? How much progress can we make without clarity in government policy?
I think everybody in this country has a right to health care. I think no family should have their entire family brought down because somebody is sick catastrophically and it takes entire resources, makes them sell their house and restructure everything they're doing.
But to be fair, I mean, most people do have insurance.
Well, right, but we had another 20+ million on the books since the Affordable Care Act. You cannot get rid of 1,000 pages of legislation without something really to replace it and change it. There are parts of Obamacare that were working, and there were parts that were not working. And what we need to do is be real adults, sit down at a table and say, how can we improve parts of it? But at the same time, that's healthcare finance. And you have to say, healthcare, health, and healthcare finance, in the end, are two separate things. For the last 15 years or so, the government has X bandwidth on health, and it's all been about healthcare finance. We need to change that discourse, and it really means a restructuring of things, and I think talking about it, and starting to look at value-based care. And it's a weird word, but this is going to be the mantra over the next several years, and certainly telemedicine is part of value-based care, is how do you do things? Right now, every pharmaceutical company with a new drug in cancer, it's $140,000 a year, irrespective of the value. You know, when you leave a hospital, you get a bill. You don't get an itemization of what everything costs. I can't say, listen, I broke my leg, it's a simple thing. Let me see which of the 5 hospitals, what it costs to put a cast on it, because I want to do what's most value. You can't do that. It's the only system in the world that, in a sense, doesn't have a price list even.
Now, you don't need legislation for that to happen, right, Stephen? But you do need the government, because the government is providing, you know, Medicare and Medicaid are providing.
Yeah, it's 150 million patients.
Are they moving in that direction?
They started to move in that direction of value-based care, penalizing people who didn't provide high quality, encouraging population health with the Affordable Care Act.
Transparency. Information.
I think that that's why this current debate is destructive. I think you got to move it forward as opposed to going all the way back to the beginning. And that is the most disconcerting.